You walk into a room and forget why you went in. A name sits right on the tip of your tongue, but it won't come. You misplace your keys again. You repeat a story you told yesterday. And quietly, in the back of your mind, a fear begins to grow. Is this the beginning of something serious? Is my memory slipping away? Before you let that fear take hold, I need you to hear this. One of the most common causes of memory trouble after 60 is not dementia at all. It's a vitamin deficiency, and in many cases, it is completely reversible. That's right. A single, common, overlooked nutrient can cause forgetfulness, brain fog, confusion, even mood changes. And here's the tragedy. Most people, and sometimes even their doctors, never think to check for it. They assume the worst. They live in fear for months or years, when the answer could have been simple all along. Today, I'm going to tell you exactly which vitamin it is, the warning signs to watch for, why it becomes so common after 60, and the safe steps to fix it. I'm Dr. Daniel Hart, and on this channel, I explain health after 60 in plain, honest English. No fear, no confusion, just what actually works. If that's the kind of information you've been looking for, take a moment right now to subscribe and tap the like button. It genuinely helps me keep making these videos for you. And stay with me to the end, because I'll reveal the surprising reason this deficiency becomes so common after 60, even in people who eat a healthy diet. It's not what most people expect. So let's not keep you waiting. The vitamin is B12, also called cobalamin. Now, you might be thinking, a vitamin? How could that affect my memory? Well, B12 is absolutely essential for two things: your nerves and your brain. It helps build the protective coating around your nerves, and it's needed to make healthy red blood cells that carry oxygen to your brain. So when B12 runs low, your brain and your nervous system are some of the very first things to suffer, and the symptoms can look frighteningly similar to dementia. Let me walk you through the warning signs, because they're easy to miss. The first group is mental: forgetfulness, difficulty concentrating, a foggy, cloudy feeling in your head, like you just can't think clearly, trouble finding the right words, and in more serious cases, confusion or disorientation. This is exactly why low B12 is so often mistaken for early dementia. The symptoms overlap almost perfectly, but there's a crucial difference, and I'll come back to it. The second group of signs is physical, and these are important clues. Tingling or a pins and needles feeling in your hands and feet. Numbness, a feeling of unsteadiness or losing your balance more easily. Unusual fatigue and weakness, the kind that rest doesn't fix. A sore, red, or smooth tongue. Pale or slightly yellowish skin. And mood changes, including low mood, irritability, or feeling down for no clear reason. If you have memory trouble plus any of these physical signs, B12 should absolutely be on your radar. Now, here's that crucial difference I promised. True dementia, like Alzheimer's, is generally not reversible, but memory loss from low B12 often is. When the deficiency is caught and corrected in time, many people see their thinking clear up, their energy return, and their tingling fade. That is why testing matters so much. Imagine spending months terrified you're losing your mind, when the real cause was a vitamin your body simply stopped absorbing. It happens far more often than you'd think. So why does this become so common after 60, even in people who eat well? Here's the surprising part I promised you. As we age, the stomach naturally produces less acid, and you need stomach acid to release B12 from your food so your body can absorb it. So you can eat plenty of B12, but if your stomach isn't breaking it down properly, much of it passes right through you. This condition, low stomach acid, becomes more and more common with each passing decade. It's one of the main reasons older adults quietly slip into deficiency. But there's another layer, and this one catches a lot of people by surprise. Certain very common medications can lower your B12 even further. The first is a group of acid-reducing drugs, often taken for heartburn or reflux. By reducing stomach acid even more, they make B12 harder to absorb. The second is a widely used diabetes medication. Long-term use has been linked to lower B12 levels in many people. Now, please hear me clearly. Do not stop any of these medications on your own. They may be very important for your health. The point is simply this. If you take them, you should have your B12 checked regularly. It's an easy conversation to have with your doctor. There are a few other groups at higher risk. People who eat little or no meat, fish, eggs, or dairy, because B12 comes almost entirely from animal foods. People who drink alcohol regularly, since it can interfere with absorption. People who've had stomach or intestinal surgery, and those with certain digestive conditions. There's also a specific condition where the body can't absorb B12 properly at all, no matter how much you eat. It requires a different approach, which is one more reason testing is so important, rather than guessing. So where do you get B12 in the first place? It's found mainly in animal foods. Meat, especially liver and red meat, fish and shellfish, eggs, and dairy products like milk, cheese, and yogurt. Some foods, like certain breakfast cereals and plant milks, are fortified with added B12, which can help. But here's the catch, and I want you to really understand this. If your body isn't absorbing B12 well, simply eating more of it may not be enough. That's why the next part matters so much. So let's talk about what to actually do, safely. Step 1, and this is the most important. Ask your doctor for a simple B12 blood test. It's inexpensive, quick, and it gives you a real answer instead of fear and guesswork. If your memory has changed, especially if you also have tingling, fatigue, or balance issues, this test should be near the top of your list. Don't be shy about asking for it directly. Step 2. If your level is low, your doctor will guide you on how to correct it. For some people, that means B12 tablets, sometimes in higher doses. For others, especially those who can't absorb it through the stomach, it may mean B12 injections, which bypass the gut entirely and go straight into the body. There are also different forms of B12 in supplements, and your doctor can help you choose the right one. The key is this: the treatment is matched to the cause. That's why self-guessing with random supplements isn't the answer. Getting tested is. Step 3. Prevention. If you're over 60, include B12-rich foods in your meals when you can. If you eat little animal food, talk to your doctor about a supplement. And if you take acid-reducing or diabetes medication long-term, make B12 testing a regular part of your checkups, perhaps once a year. A small, simple habit that protects something priceless: your mind. So let's bring it together. Memory trouble after 60 is frightening, but it is not always what we fear. A common, correctable B12 deficiency can mimic dementia almost exactly, causing forgetfulness, fog, tingling, and fatigue. It becomes common with age because of low stomach acid and certain medications, and the answer often begins with one simple blood test. So before you assume the worst, rule out the simple things first. You may find that the fog can lift and the clarity can return. Everything I've shared today is for your education, and it is not a replacement for your own doctor who can test you and guide you properly for your situation. Please don't begin high-dose supplements or change any medication on your own. Bring these questions to your next appointment instead. If this video gave you peace of mind or something useful to act on, please do me a small favor. Hit the like button and subscribe so I can keep showing up for you each week. And tell me in the comments, did you know that a vitamin could affect your memory like this? Your answer might help someone else who's quietly worried. This is Dr. Daniel Hart. Take good care of your mind. It's worth protecting.